Hey everyone! Welcome to Gloria Alparo channel. Before watching the video, don't forget to subscribe to my channel by clicking the subscribe button below and clicking the bell icon to be notified whenever I publish a new video. Today we're going to learn about various types of insomnia, causes, risks and side effects, treatment. A sleeping disorder is a typical rest issue that makes it difficult for you to nod off or stay unconscious. It prompts daytime drowsiness and not feeling refreshed or invigorated when you wake up. It can influence anybody, yet it's extensively more normal in ladies and more established grown-ups. It can last a couple of days, weeks, or proceed with long-haul. Stress, menopause, and certain clinical and psychological well-being conditions are normal reasons for sleep deprivation. Various types of insomnia. There are a couple of various sorts of a sleeping disorder. Each type is described by how long it endures, how it influences your rest, and the basic reason. Acute insomnia. Acute insomnia is momentary, a sleeping disorder that can last from a couple of days to half a month. It's the most well-known kind of a sleeping disorder. Intense sleep deprivation is likewise alluded to as alteration, a sleeping disorder, since it commonly happens when you experience a distressing occasion, for example, the demise of a friend or family member or beginning a new position. Alongside stress, intense sleep deprivation can likewise be caused by environmental factors that disturb your rest, for example, clamor or light, sleeping in a new bed, or environmental factors, for example, a lodging or new home, physical distress, for example, torment or being not able to expect an agreeable position, certain meds, illness, jet slack. Chronic insomnia. A sleeping disorder is viewed as incessant in the event that you experience difficulty dozing in any event 3 days of the week for at any rate 1 month. Incessant sleep deprivation can be essential or auxiliary. Essential constant, a sleeping disorder, which is additionally called idiopathic, a sleeping disorder, doesn't have a conspicuous reason or basic ailment. Optional, a sleeping disorder, likewise called comorbid, a sleeping disorder, is more normal. It's incessant, a sleeping disorder that happens with another condition. Regular reasons for incessant, a sleeping disorder include chronic ailments, for example, diabetes, Parkinson's malady, hyperthyroidism, and obstructive and focal rest apnea, mental well-being conditions, for example, sadness, tension, and consideration shortfall, hyperactivity issue, medications, including chemotherapy medications, antidepressants, and beta blockers, caffeine and different energizers, for example, liquor, nicotine, and different medications, lifestyle factors, including continuous travel and stream slack, pivoting shift work, and snoozing. Onset insomnia. Onset insomnia is inconvenience starting rest. This kind of sleep deprivation can be present moment or incessant. Any of the reasons for intense and ceaseless a sleeping disorder can make it hard to nod off. Mental or mental issues are the most widely recognized causes. These incorporate pressure, nervousness, or gloom. As per a recent report, individuals with interminable beginning a sleeping disorder frequently have another rest issue, for example, fretful leg condition or occasional appendage development issue. Caffeine and different energizers can likewise keep you from nodding off. Maintenance insomnia. Maintenance insomnia is trouble staying unconscious or getting up too soon and experiencing difficulty returning to rest. This sort of a sleeping disorder makes you stress over not having the option to fall back snoozing and not getting enough rest. This meddles with rest further, making an endless loop. Maintenance insomnia can be brought about by psychological wellness conditions, for example, melancholy. Other ailments that can make you wake up include gastroesophageal reflux, ailment, sleep apnea, asthma and other respiratory conditions, restless leg disorder, periodic appendage development issue. Behavioral insomnia of childhood. Behavioral insomnia of childhood (BIC) influences around 25% of kids. It's partitioned into 3 subtypes. BIC sleep onset. This sort results from negative relationship with rest, for example, figuring out how to rest by being shaken or breastfed. They may likewise incorporate having a parent present or staring at the TV while nodding off. BIC limit setting. This sort of BIC includes a kid's refusal to head to sleep and rehashed endeavors to take care of off-going. Instances of this conduct are requesting a beverage, to go to the restroom, or for a parent to peruse them. Another story. BIC combined type. This structure is a mix of the other two subtypes of BIC. This happens when a kid has a negative relationship with rest and opposes hitting the hay on account of an absence of cutoff setting by a parent or overseer. BIC can ordinarily be settled with a couple of conduct changes, for example, making a solid rest routine or learning self-calming or unwinding methods. Risks and side effects of insomnia. A sleeping disorder can cause various dangers and symptoms that influence your psychological and physical well-being and affect your capacity to work. Risks and side effects of insomnia include decreased execution at work or school, increased danger of mishaps, increased danger of discouragement and other emotional well-being conditions, increased danger of constant ailments, for example, coronary illness, stroke, and stoutness. Treating insomnia. Treatment for a sleeping disorder fluctuates and relies upon the reason. You might have the option to treat intense a sleeping disorder at home with an over-the-counter tranquilizer or by dealing with your pressure. Treatment for interminable a sleeping disorder may require tending to any hidden condition that is causing your sleeping disorder. A specialist may suggest psychological social treatment for sleep deprivation, CBT-I, which has demonstrated to be more successful than medicine. Diagnosing insomnia. Diagnosing sleep deprivation may incorporate a physical assessment and a review of your clinical history to check for indications of a basic condition. You may likewise be approached to follow your rest examples and manifestations in a rest journal. A specialist may allude you for a rest study to check for other rest issues. Thank you so much for watching. If you liked the video, give them a thumbs up, share with your friends and subscribe to this channel. Please click the bell icon to be notified whenever I publish a new video.